everybody. How has been your day? Okay, on today's episode of the Very Eureka Moments, we'll be talking about erectile dysfunction. Now, erectile dysfunction. Now, one ogbenge problem where men they get when it concerns sex is the problem of getting hard and not getting hard, standing well and not standing well. When a man is finding it difficult to stand, or he don't stand though, start action, but along the line, the standing disappear. Symptoms of erectile dysfunction. How do you know that what that man is going through is an erectile dysfunction or erectile disorder? Ngwa, hear me out. Inability to have an erection. I don't talk, I'm saying the man, they get problem to even hard, they will harder. Trouble achieving the erection. Here, you go ask me inability, trouble. Inability means you no go even fit stand. Trouble means he want stand. He dey work at it, but he no go even stand. Loss of erection because sex is over. Okay, he don't manage stand small. As they do the thing, they stand and disappear. Premature or delayed ejaculation. Interest in sex, but organ no fit perform. If you go near reduce sexual desire, these are the symptoms of erectile disorder. So, just in case in your relationship you're seeing these symptoms, be checking it out. Organ with problem. Let's continue. This thing. What are the causes of this erectile dysfunction? There are some medical causes and there are psychological causes. We cannot overstress. There are some problems that if you have in your body, you'll be bound, you will be exposed to having this erectile dysfunction that we are talking about. You know that male problem, the thing with male sexual arousal and male sexual, function is such that both the brain, the nerves, the blood vessels, the muscles, as in emotions, hormones are all involved for men in sex. So any problem with anyone can bring another problem in to this particular aspect of their lives. Physical causes responsible for this problem: sleep disorders, treatments for prostate cancer and for prostate problems too, surgeries, low testosterone. I've said it, testosterone is a hormone that is responsible, for sex and sexual related, activities in the body of men. So if this hormone is low, the man might be having problems with erection. But what are the mental causes? That's the psychological causes of this problem. You have stress and anxiety. Hi. Stress and anxiety. When a man is stressed, becoming aroused will be the last thing on his mind. Although sex can calm anxiety, it can calm stress, but this one is a different kind of stress. Performance anxiety. When a man is always worried before sex, he's always worried, will I be able to satisfy? Will I not be able to satisfy? Problem. Depression. Depression can cause a lack of interest in activities, not to talk of sex. So sex is another activity. So a man that is depressed may have problems with his erection. Relationship concerns, feeling of guilt, low self-esteem, cultural and religious beliefs, trauma. It's not the only woman and they get trauma. Some men, they get sex trauma, and all those things, they affect them. And these things, if you don't watch them, one will keep leading to the other, that one will keep leading to one, becomes a very vicious cycle. That's the reason why you have to take care of it. What are the risk factors? What do we mean by risk factors? When we talk about risk factors, we'll talk about what can predispose you. If you have if these things are present here, it means that the chances, like likelihood that you are going to have this erectile disorder. Medical conditions like diabetes and heart problems. tobacco use, overweight. There are some treatments that you'll be having. Injuries. Makande, bite me, choke me here, don't bite me. Injuries on the penis can cause this problem. Medication, so alomo bitters, ogbonge, abo heaven and earth, all of them you drink, they will begin be damaging some of the things that you're supposed to use and work. Then psychological problems like stress, anxiety, depression. Watch out though, if these things are present in your life, erectile disorder may be there. Even drug and alcohol use. I be big boy, I be big man. Any drug you see, you smoke, alcohol, you drink. Bobo tibo, 100 naira home with the chemicals inside. You just be taking warm inside your body. They are helping you now. What about them? What about later? Well, complications. The challenge with all these things is that you will just have an unsatisfactory sex and you'll be suffering in one get mad. You just be suffering your partner. You know, there'll be stress, there's anxiety, embarrassment, relationship problems. And if care is not taken, you know, go even give woman belly if you get this problem. So you need to watch out to it. You need to take care of yourself. Then how will those of us that handle this problem, how can we diagnose and say true? All this is where they talk. It's an erectile disorder. Now be the problem. Physical examination. Your doctor will check you where, check your penis, check your testes, check your sac, check everything. Put hand there, check where, to be sure that your nerves are working well and blood is flowing. They will run blood tests too. The blood test is to rule out diseases like diabetes, like heart problem. Check it for hormone is okay. They can look for your liver and your kidney function. Are they doing well? They will do urinalysis. Even ultrasound. Not be only woman they do ultrasound though. Men they do pelvic ultrasound. You get one where they do too. They call them nocturnal penile tomosynthesis. That is, they will check the erection of the man in the night, the strength of the erection in the night when he's sleeping. You don't know, say men they get erection and they sleep and you open your eyes as well. I don't give you assignment, madam. As long as they sleep, they check and well, especially around 3 o'clock and 4 o'clock. So I did not tell you. Thyroid tests, psychological examination. So when your doctor don't make you finish, don't say, this your problem is not medical now. They go refer you to psychologist. They take you up from here. We will look at you, examine you in the head to be sure and to know where the problem is coming from. Madam Sobwadiro, there are treatments. All hope is not lost, guys. It's the ministry that we are in. Your doctors can give you pills. Manabiko, with these pills, don't, because you hear some names, you go and start buying them yourself. Strictly on prescription, please, guys, because not everybody sabi use and wear. Now, I know some people go just take drug, drink one. When they go do, they die. They say, they collapse on top woman. They don't go to say, drink medicine before they start activity. Check and wear. You get one what they call penis pump. They pump the penis so but now your doctor will tell you as you go take do them. There are some implants, surgeries that they can do for you to help you to boost your erection so that you can at least have sex and enjoy it. Psychotherapy, guys. Psychotherapy, counseling. Because psychotherapy is not just for mad people. It's for anybody that is going through mental, emotional challenges. It's all about talk. You know, you talk it out. We help you to examine your thinking and all of that. That's what psychotherapists do. Just brief summary. They just help you by discussing with you. Okay? So don't be afraid to visit a psychotherapist for some issues that you may be having. It's also for your own good. Couples counseling. You come with your spouse, you come with your partner, then we talk about it. So let's find out what exactly is causing this problem. And how can you even manage, just in case it's not even a psychological, let's assume it's even medical. As it is medical, it could be causing problems in your relationships. So you also need couples counseling to help both of you manage the situation that you are facing. Relaxation techniques, these are taught in therapy, you know, how to calm yourself down, how to relax, how to practice visualization and meditation to help you. Then Even if it is strictly psychological problem, there are some other medications that can be given to you to help you manage it. So what we call treating the mind and the body. What can you do to help yourself, men and brethren? If you dey smoke, quit. If you dey obese, lose excess pounds. Include physical activity in your daily routine. Get treatment for any problem where you get. No kuku dey treat yourself with anyhow treatment that you meet in the street and in the gutters. Bikono. Walk through your relationship issues with your partner, with your spouse. There's nothing that cannot be resolved. You can resolve to go, or you can resolve to forge ahead. But walk through your issues so they don't begin to affect this aspect of your life. Don't assume that your problem is lifetime, is forever, no solution for you, and you'll be ruminating and be suffering. There is hope for you. Involve your sexual partner. I keep saying this. Involve your sexual partner. Speak the truth. Open up to your partner so that together you walk through whatever it is that is doing you. Please don't ignore stress, anxiety, or other mental health concerns. Don't ignore them, please. Take them seriously, especially in the times that we are in. So that's about it, guys. I hope you enjoyed this session. Keep a date with me till all the time while I bring you tidbits on sex and healthy sexual life. Remember, it is my goal that we optimally enjoy sex in our relationships and in our life partnerships and in our marriages. Give me your feedback, your likes, your comments, and your recommendations. In my DM, I'm always available. All right, guys, my name is Ebere Obiokwe, and this remains Bebe Eureka Moments. Ngwanu bye bye. Kodibaziano. Ciao.